Good morning, everyone.
Good morning.
Welcome to the April meeting of the Bronx Borough Board. My name is Tom Lucchini. I'm the Deputy Chief of Staff. I welcome you all here today. We are being live televised by BronxNet. And I will at first do our roll call of members. Just please acknowledge your attendance when I come to your board or to your council member name. Community Board number 1. Community Board number 2.
Good morning, Ralph Acevedo, District Manager. Good morning, Tom.
Good morning. Community Board number 3.
Good morning, Joetta Brown, Chairperson, Community Board number 3.
Community Board number 4.
Good morning, Beverly Bond, Chair, Community Board.
Community Board number 5.
Walking in.
Say your name, Angel. Community Board number 5.
Angel Cavalier.
Good morning, Angel.
Morning.
Community Board number 6. Community Board number 7.
Good morning, Carla Cabrera Carrera, District Manager.
Good morning. Community Board number 8. Community Board number 9. Community Board number 10.
Peter Cantillo, Vice Chair.
Community Board number 11. Community Board number 12. Going on to the members of the council, Deputy Speaker Ayala,
Alicia Miranda on behalf of Deputy Speaker Ayala.
Councilmember Dinowitz,
Stephanie Rodriguez on behalf of Councilmember Dimmitt.
Councilmember Riley,
Andy Turcios on behalf of Councilmember Riley.
Councilmember Marmorato,
Good morning, Mark Nice, representing Councilwoman Marmorato.
Councilmember Sanchez, Councilmember Feliz, Councilmember Stevens,
Deputy Chief District Director Tariq Israel, representing Councilman Stevens.
Councilmember Salamanca, Majority Leader Farias. Okay. Once again, thank you for being here. We have 2 items on the agenda today. The first being the Not 62 campaign for a healthier Bronx, and the second being a presentation by FloodNet on their project update. We will first begin with the Not 62 campaign, a presentation by the members of the Not 62 campaign for a healthier Bronx steering committee. There are a number of presenters. Let me just go through them all, and then we will ask who will be making the presentation to come up to my left. Dr. Maria Isabel Rodos, Fabian Wander, Director of the Counseling Center at Hostos Community College, Monsignor Donald Sacano, President of Highbridge Community Development Corp., Cheryl Simmons Oliver, New York City Health and Hospitals, Lincoln Hospital. Yes. Also representing the New York City Department of Health, our friend and colleague, Dr. Bola. And also, as a part of the steering committee, is the Bronx Borough President's Office, represented by our Deputy Director of Health, Maknoor Jara. So I will turn it over to whom first? To you?
Monsignor.
To Monsignor? So, Monsignor?
Good morning, everyone.
Good morning.
So again, I'm Monsignor Sacano, and I'm president of Highbridge Community Development Corporation, and actually going to a meeting there after this one to discuss improving, remodeling buildings, 23 of them, that 40 years ago were vacant, burnt-out buildings. And through efforts from, and that was the Koch administration, HPD, we renovated, it was substantial renovation, those buildings, and that was 40 years ago, and now we're remodeling them. But those were victims of displacement back then, and some of you, not all of you, remember the burning of the Bronx and the displacement that occurred. Well, I've learned over those 40 years that displacement can occur not only because of fire and economic conditions, and the building of the Cross Bronx, actually, which had a great deal to do with displacing neighborhoods and people. But also, people can be displaced because they grow older and face health challenges that catapults them into hospital beds, and then even the dreaded nursing home, and never come home again. So we need to intend that not to happen anymore. That needs not to happen. And so, emanating from the terrible title of the Bronx being considered to be the most unhealthy county out of the 62 counties in the state of New York, which is a report that the Robert Wood Johnson Foundation has done since 2009, I believe. So every year we've been labeled as the most unhealthy county in the state. And it is not because of the regions above Fordham Road. You know, it's basically the South Bronx and conditions there. So we need to do something about it. And so we're here really to discuss. I would like to think, breaking down the barriers between policies and practices. And we're going to talk about policies today, but we also need to talk about practices that really empower not only agencies and government and the faith community, but every person in the Bronx needs to be empowered to be not just a participant in this effort, this campaign to make the Bronx the most healthy county. Yes, the Bronx the most healthy county, and it can be in the state of New York. But every person in the Bronx needs to be a provider themselves. And I think that needs to be our goal of what techniques, what tools can the strong people of the Bronx be provided to make them themselves the providers of their own health and of others, and they must see themselves, that way. So one of the techniques that we've talked about are the establishment of healthy destinations. An effort that we've undertaken in the hybrid section, and there's other areas of the Bronx that have done this, is founding of what's called farmers markets. All right, but a farmers market immediately conjures up in most people's minds the Union Square model or something like it, where actually healthy food is quite expensive, right? So there needs to be a way to make healthy food accessible and available to people of the Bronx, in addition to an array of other opportunities to improve their well-being, their health, and their ability to be practitioners of good health themselves. That is, to take care of others, members of their families, and people that they meet and greet, on their way in the Bronx. So the term healthy destination is a broader one than farmers market or a place where people can get access to food. It's also an array of services, and it becomes a forum. Think of it as an open forum that exists in a community for people to gather and exchange information and learn about health and food. So our recommendation is that there be an establishment of healthy destinations throughout the city. And in order to make food, healthy food, affordable, there's the Health Bucks program, all right, which is very limited, and we're recommending that it become a statutory feature of the city, so that low-income people have a voucher or a way to purchase food that is healthy. And other recommendations that we have is to, I'd like to think, is to turning schools, cafeterias, and restaurants and stores into healthy destinations too, that they become aware that they are part of a campaign to change attitude and the practices of people in terms of how they purchase food and consume food. So we're looking for legislation that puts restrictions on or recommendations for families and restaurants and stores of how they can purchase food and make them available to their families. All right, so that's my presentation today.
Thank you, Monsignor. Good morning, everyone. My name is Fabian Wander. I am a clinical social worker. I work at Ostos Community College. And I'm going to be presenting a wonderful presentation put together by Dr. Maria Isabel Rodos from Lehman College. I think she's held up on her way over here. So I'm going to jump in for her. The idea of the Bronx obviously being the last place in a sense of health outcomes and health equity in New York State. Out of 62 counties, us being in the last place isn't something we're proud of. There's a lot of wonderful things happening in the Bronx. So as a steering committee, we're looking at having conversations and developing recommendations for policies that can have an impact and hopefully bring us to a better place in these rankings. Mental health is obviously interconnected with your physical health, your spiritual health, emotional health, and it's really important as we look at health equity and health issues in the Bronx. We look at mental health. We put a lot of attention and focus in this area. So we've come together with our steering committee, made up of various health institutions, educational institutions, faith-based institutions, really diversifying the steering committee and looking at mental health and how do we improve mental health in the Bronx. With that being said, we've come up with 7 recommended initiatives that we hope would make an impact and a difference. Ensuring that Bronx residents have access to a range of mental health services, including crisis intervention, counseling, therapy, and psychiatric support. We know that, and working as a counselor in the counseling center and also my own private practice, the amount of time that people have to wait for an appointment can be months. And, the real need is immediate. Waiting months for an appointment to speak to a social worker or a psychiatrist is just not working so well, especially where we're in a crisis. And we want to really avoid hospitalizations of folks. Everyone is impacted by mental health, and it could be stress, it could be family, it could be financial, it could be housing. It's all kind of interrelated. Initiative 2 is really launching an anti-stigma campaign to normalizing these conversations about mental health and encouraging residents to seek help when needed. And that's something that is really important because we know that the reality is a lot of people who need help are embarrassed to go for help, there are a lot of cultural barriers to engaging in these conversations, and they don't get the help they need. We know a recent study at CUNY that close to 50% of students reported feeling symptoms of depression and anxiety. However, not a big percentage of that 40 to close to 50% did not seek help, right? And why didn't they seek help? I mean, those are the things that I think are attributed to the stigma. We do have counselors on the CUNY campuses. They're easily accessible versus the community, but they're not seeking help. So we really want to address that stigma through different initiatives that can be laid out. Developing partnerships with social service providers, schools, local businesses where mental health services are provided alongside with essential services such as housing, employment, and substance use treatment. This is a really community-based approach of treating mental health, not just from the perspectives of the mental health clinics or outpatient clinics or hospitals, but really looking at it as a holistic approach to how do we address the mental health of folks in the Bronx. And we know that financial stressors can lead to, a lot of these challenges, including the increased use of substance use, housing issues, housing insecurity, poor housing conditions, instability, right, and the children that have to constantly move around. That all impacts those the mental health of themselves and their family members. Another policy that we're recommending, which was kind of something that was laid out a few years ago, is the mental health first aid training, and it's really about educating and empowering people in the community to know how to work with their neighbors, their friends, and their families if they're impacted from any kind of mental health condition. Really learning how to engage, how to support, and then how to connect people to the help that they need. So again, it takes a village to address this issue, and everyone has to play a part here. The other types of trainings that have been effective are the naloxone trainings, and we offer many of those on our campus. They're offered in the community, and this really has shown to be effective in reducing overdoses in the Bronx, which is a really high number of overdoses. So really empowering community members, empowering all of us to really know how to support each other. Policy number 5 is really looking at encouraging clinics to take on a contingency management therapy approach towards encouraging people to be in therapy or in groups or in any kind of supportive treatment. This approach looks at reinforcing the benefit of coming into groups and treatment, and that might be through different types of reward systems that can encourage them to just be consistent with treatment, right? Because they might start and then just kind of drop out from there. We looked at policy number 6 is providing funding for training and scholarships to increase the number of mental health providers in healthcare industry and higher education health related fields. We know that the Bronx has less mental health providers than are needed. I don't have the exact number, but it was in the latest Robert Wood Johnson report, the ratio from people living in the borough to providers, and we're low on that compared to the other counties in New York State. The other important aspect of the training is really educating younger people to be trained, to be certified in mental health first aid, to be certified in and educated in these areas as they transition from, let's say, middle school or high school. Then we can look at, those students then eventually becoming mental health providers or providers of health care in general. Again, exposure to younger people and being certified and creating credentialing opportunities as well. So then when they do graduate from high school and gives them opportunities in higher education or in the workforce. So this is encouraging more people from the borough to really engage. And our final policy that we recommend is expanding and investing in New York City Behavioral Health Emergency Assistant Response Division. And it really ensures that mental health crises are treated as health problems and not public safety problems, because we know that if clinicians go out with law enforcement, and I've done this in the past through my work in mobile crisis, working with the people in the community is a really more effective way of getting the people the help they need. And also it reduces the amount of stress that's put on to these public safety providers. So finding that support of having a social worker or mental health clinician to support our public safety officers, I think, is super important and will be helpful in getting them the help they need, and also will prevent a lot of crises that can be preventable by just having that conversation with someone who has been trained and exposed to that particular area. So these are some of the recommendations. I'm just going to fast forward to kind of the overview of the policies. Immediately looking at self-help groups, strengthening mental health capacity, creating opportunities for financial and technical hands-on training and scholarship, kind of what I mentioned before, really certifying high school students, college students, young folks, people in the community on how to engage with people's mental health, improving access to mental health services, obviously reducing that stigma, which is what is super important for people to feel comfortable in engaging in treatment. And on a longer term scale, advocating for a more integrated model where all of these entities that service the healthcare of the community work together to support individuals, families, and community. And of course, creating funding opportunities for mental health providers and clinics to have more folks that can do this work. Dr. Roldas, who actually has done a really great job putting this presentation together. Did you want to add anything or?
First of all, my apologies for arriving late. I parked inadvertently in the judge's parking spot, and I was quickly swifted out of that spot to find. So that was the reason why I'm late. I mean, Fabian, thank you so much for for making the presentation for our group. I think that the focus of our subgroup was two. Most importantly, one is to have an outcome measure coming in, that we knew what we were measuring our baseline on: number of people being served, number of people being certified, number of physicians times 10,000 people in the Bronx, so that we actually knew where we were starting on. And then we divided the mental health policy of those that were immediate, short-term, and long-term, focusing in the immediate ones and those that have to do with self-help and strengthen the capacity of healthcare providers or mental health providers. So self-help for us means life-saving certifications for the population at large, training people to help themselves, that being, stop the bleed, mental health self-help, mental health for adults and in adolescents, especially for those to identify signs of mental distress, anxiety, as well as signs of suicide. We all back these on signs, on the data that what are the biggest risks that we have in the Bronx. So having those certifications out and as many people certified seem to be one of our priorities. And the second one is really get more young people interested in these careers. And that only means not only eliminating some of the barriers for them to access education or higher education, but also opportunities for the clinicians to have those jobs being filled. And a lot of the positions are not being filled because they don't want to work in the Bronx. So we have to work on both sides. So we see those to be immediate. And something that we can get the ball rolling, I'm going to say 90 days, right? We can get a lot of people certified in a short period of time so that we can also reduce the risk, the demand on those services. The short term, which is reducing stigma, expanding the be heard, and health literacy, takes more time to mature because it requires those issues about collaboration, engagement, seeking partners, and sometimes we just can't wait that's a revolving door that can take a long time. And I think the Bronx needs immediate outcomes now, which is why we divided them in medium. And then, of course, the long term, they all build on each other, is to have those integrated care models that have a better referral and treatment options for our population. And I'll stop there.
We're just opening up to any questions. It's just...
Can I ask you a question?
Yes, just give me 1 second.
There you go.
Okay, first of all, thank you for the presentation. Welcome, Doctor. Yes, for questions, Peter, Community Board 10. Yes, so please use the.
How do they measure the 62 counties to be, healthy? What are the parameters? What are the indicators that make that distinction?
Okay, so I actually know a little bit about this. I didn't look at the data for 2025, but I did look at it for 2023 in a paper that we published at Lehman. So the model that the University of Wisconsin has, the Institute of Population Health, is looking at secondary data that is normally 2 years lags, at least 18 months is not 2 years. And they divided them either in health behaviors and health outcomes. And there's 3 health outcomes that they look at. Premature mortality, a health-related quality of life, Actually, those are the two main ones. Once they look at the data, they basically contrast that number to the threshold or to the average, to the national average. And that's how they make a ranking. So first they anchor the ranking, and then they anchor where we are to make, anchor it in as a relative point of comparison. I've always done this, and I'm happy to share our paper. That ranking is a snapshot of what the population is basically 18 months ago, not today, right? So it's almost like I always make this analogy, even when I teach that paper, is like looking at the diary of a person the day that they look at the diary. Is that a representation of that person's life because you read that page of that diary? Maybe not, or maybe yes, it could be otherwise. I would argue no. I believe that the best argument to look at the Bronx is to look at the trend. And you can't look at the trend of 3 years. You have to look at the trend at least of 10 years, because that's how long it takes health to accrue a benefit. So if I tell you tomorrow, stop eating this food, I won't see your weight loss in at least a year or 2 years, right? So that's the same argument. So if we look at the trend of the Bronx, actually the trend is doing better, and better than many of the counties in the north or rural areas of New York. Is actually probably in the top 10 in terms of trend. Not only because the trend is decreasing, but also because of that slope of the curve. So the slope can be, we're reducing from 4.1 to 0.40. Okay, it's increasing 0.2. The Bronx is decreasing like from 6 to 2. So the slope is really, really steep in most of the indicators, with the exception of 2. And again, this is data that I reviewed personally, which is why I can speak in this tone. Except with two indicators, 2023. Again, I'm 2 years behind in this data. Adult diabetes and injury related to violent crime. Those are the two indicators where the Bronx still remains in an upward trend compared to the other counties, because you have to compare it to something. Otherwise, it's really just a number, in my humble opinion. So the way that the population, that the county rankings does it, is looking at secondary data that is public and that is lagged at least 18 months. If you would ask us as a subcommittee, what would be the next stage of something that we will reunion, is that we look at our own data. We have such a robust New York State data that it's not being analyzed in a trend type of way to really capture these nuances of beginning and ends of curves. But we keep following back on the rankings. It's a standard. It's there. The methods are robust. So it is what it is.
Obesity is one of the indicators.
Obesity it's not an outcome, but it's a risk factor. So they have two health outcomes, like I said, that are really strong: premature mortality and health-related quality of life. The other factors, including obesity, smoking, exercise, they put them as risk factors, and they're categorized in that way. Yeah, but Manur knows more too.
Thank you, Tom. Thank you for the presentation. I think maybe you might have just answered somewhat my question, because it was all geared towards mental health, but I didn't see nothing about like physical activity, recreational, open space. I know that can be a factor into why we are. Can you just, discuss that, elaborate on that? Thank you.
Great question. Good morning, everyone. My name is Mahanur Jora. I represent the Borough President's Office on the steering committee. And I just wanted to add, I agree with everything that Dr. Roldo shared. And the way that the county rankings come out, they're annual. And for the first time last year, the Robert Wood Johnson's, they switched up the way they're reporting on this as well. So instead of using like the county ranking numbers saying like the Bronx continues to rank 62 of 62, they've switched over to a color-coded system, which is why you see the colors the way they are now. And I think on the previous slide, there was a green. So we're able to compare ourselves to other counties based on the intensity of the green. So if you're a lighter shade, that means you are among the least healthy counties. If you are darker green, you are among the healthiest, and it helps you draw comparisons. So the purpose of the Not 62 campaign right now is to change that narrative so that we are able to highlight the positive, the improvements that are happening in our borough. And so based on the rankings and the assessment that they came out with last year, the committee decided to focus the 5-year plan on 5 specific areas, which touch on what you're mentioning. So that includes, 1, the healthy food access and food security, mental health, workforce and economic development, healthcare access, and the urban environment and housing quality. Because we realize that the social determinants of health as well as the community surroundings have a huge impact on the overall quality of life. So those are all of the aspects that we will be touching on. The reason why mental health and food were part of this presentation is because those are the priority areas for 2025. In this coming year, those are the policies that we will be looking to share with you all in moving forward. And the whole purpose of the committee right now and the campaign is to build momentum around improving health outcomes in our borough. So it requires everyone's support from a community level to our electeds, our advocates, the hospital systems, government partners, the Department of Health and Mental Hygiene, and really all stakeholders in our borough to be able to relate with this and just find some sort of next step in there for them. I hope that answered the question.
Councilmember Stevens.
Thank you for the presentation, everybody. I appreciate all the information that was shared. I'm just, I don't know what I am. I'm just kind of concerned that we're having a conversation about healthy food and mental health services, but there's no conversation about infrastructure. We can want people to eat healthy all day, but if their supermarket is selling tomatoes that go bad in 20 minutes, I don't know how to get them to buy it. No matter how much money, no matter how much messaging we put out there, the access isn't there. So it just seems like we are getting ahead of ourselves in this conversation. And I really think we should probably go back to the drawing board and really look at how we increasing the access first before we worry about the messaging. I love farm stands. There are only 2 now in District 16, and they both close in October. People still need to eat all year.
I think that and again, I'm more representing the mental health subcommittee here. We look hard to the data of what is causing young people, especially in the Bronx, to die, right? And those are injuries. They're accidents. Accidents are not, they're accidents. They can be prevented. And that's why we focused on, and we understand the structures are long lasting and can actually hit bigger groups of the population. But when it comes to premature mortality, injury is the number 1 cause, especially among men and especially young men of a minority background. For the committee, our number 1 focus was what can we do to prevent mortality in a year round. So structural policies are very hard. Interventions are hard to implement and hard to measure because it could be the reason for many things. But when it comes to measurement, especially from the policy cycle, we wanted to focus on those that within a policy cycle, we can see a reduction in mortality, in less 2,500 deaths a year in the Bronx because of injuries, way too many, right? 2,500 too many. So any reduction of 1 is important. So that's why we focus on these type of interventions, especially for the immediate ones. If we can get more people basically certified on stop the bleed. If you see an injury, you know how to handle a bleed, so that person would make it to the hospital safely without having a disastrous outcome is a win already. If we can have more self-help groups that deal with addiction, that deal with mental health in as many places as possible, in every block if possible, is 1 less accident at cost of suicide. So we understand that, and that's why we want to move forward to the structural ones. But at least the perspective of the mental health was to break those to the ones that are immediate to stop the trend, and then medium and long term, if I may.
Good morning, everyone. Joetta Brown, Community Board 3. Your presentation is excellent. However, I want to suggest or ask that, did you think, or in the process of writing this, did you think about intervention into individuals and families prior to the need to implement the Narcan and Naloxone policies? From the mental health status, many of our families are started by young people. I mean, young people as early as age 14. Okay, what is the intervention that can be planned for that age group, or even the interruption of the family before age 14? Anytime ACS has to go in and intervene in a family when a child is at birth, let's just keep it at birth, from birth on up, that calls for long-term intervention. Because if you have intervention at that age and then they receive care or instruction in the norms of family living or societal living, then perhaps the reduction of the of drug use and incarceration and people thinking that they have to go out and shoot somebody or otherwise hurt, maim, or injure somebody, it needs to start at that early age. What are your thoughts on that?
Are you asking me?
Yeah, I can speak on that. I think part of the recommendations is really getting into those middle schools and high schools, working with those younger students, because if they're educated on mental health first aid, and for example, they understand how different areas impact one's mental health, and also they know how to get that help. So a lot of that is preventative, where even if you're just doing this training just to get this training, or a teacher recommends you to do it, you're learning, and you're also learning how to support your community and peers, and you're also learning how to deal with stressors yourself, and also learning about resources that you can connect to. So we definitely agree with the idea of being proactive, being preventative, and educating folks about these things that maybe culturally a lot of communities do not want to talk about. And yes, the prevention is important at a younger age, which will hopefully prevent folks from getting into substance use and abuse and other issues that you mentioned just now.
If I might, so going in supporting what my colleague has said here, one of the things that we struggle, at least from the educational point of view, is how can we bring the community into the classroom, right? And the community problems into the classroom. And when the community problems are brought into the classroom, there is a greater reception of them understanding. So if we're going to talk about diabetes, for example, in the classroom, the likelihood that a kid or a young kid has a family member that has diabetes is probably high in the Bronx, right? So the information they receive in the classroom, as well as their personal experience, is really impactful. So when we are talking about bringing for example, the self-help youth modules into the high schools or even the middle schools, that's really what we mean. That they understand that by also knowing that they probably have a peer, a family member, or someone they know that has this issue. And you're 100%, if not 1,000%, if that would exist, that prevention is the solution. And I say this, I don't know if Dr. Bola said it, we've been looking at opiates in the research that I'm doing. In opiates, it's becoming a chronic disease because methadone is the only way for to deal with withdrawal symptoms. So we're not looking at treatment and then they're done. Their treatment is lifetime. And it's becoming a chronic disease self-management issue in the next phase. So it's here to stay. Because if we don't keep they will continue, they will relapse because the withdrawals are. So prevention is before onset, because once the onset begins, it's going to be a chronic disease type of management. So you're right, prevention.
Thank you very much. Any other, excuse me, any other questions? Well, first of all, I want to thank everybody for attending. I also want to acknowledge that there are members of Essence Health who are also members of the screening. NY Reach, I apologize, who are also. Oh, okay. So, Isamar Lopez, okay, Community Health Operations General Manager at New York Reach, and Sudenti Gutam, Director of Food Insecurity from New York Reach. Welcome and thank you for your work as well. This presentation, I think, is able to be shared with everybody, so we will email that to all of your offices. You can reach out to MacNor if you want to possibly have any presentations made at your health committees, at your offices. Please use them as a resource, as well as obviously our friend Dr. Bowler in the back, who has always been helpful to us and is a very big part of this presentation as well. So if there are no other questions, thank you all for being here.
Thank you.
And I just want to see, is Veronique here? You are Veronique, yes. Okay, thank you all.
Thank you. Stay healthy.
We have our second presenter here, so just give us a couple of seconds to set up. And Julie Reyes and Councilmember Salamanca's representative, you can come to the table. There's space now. See here. Yeah, right here. Oh, yeah, sure. Oh, okay. You good? Okay. So our second presenter today is Veronique Ignace. She's the adjunct lecturer at the Health Services Department of CUNY City College of Technology, and she is here to give us an update on FloodNet.
Thank you, everyone, for having me today. Again, my name is Veronique, and I am working as the Community Engagement Manager for FloodNet NYC, which is a project partnership primarily being funded by New York City DEP, but conducted through leadership from researchers at CUNY, Brooklyn College and the Advanced Science and Research Center, and NYU's Tandon School of Engineering, as well as the Mayor's Office of Climate and Environmental Justice. So I'm here today to provide you with an overview of what this project is and share with you some of the updates of what we've been doing since we started. But I would love to take any questions that you may have about any part of this project, including feedback of some of the things that we've done in the borough. So as I mentioned, this project is being conducted in partnership with a few groups, and what we're seeking to do is develop tools to monitor flooding in real time. Primarily, those tools which I'll go through include a flood sensor that our team has developed and has been deploying across the 5 boroughs, and a public data dashboard where information from those sensors can be looked at in real time. But my work as the community engagement manager is to support this project by developing educational programming, outreach, and other tools that can ensure that the various folks who these tools are meant to support, not just city planners and agencies, but also residents and organizations, that they can both understand them and use them. I talked a little bit about our partners, but I neglected to mention that we also work very closely with partners at New York City Office of Technology and Innovation, who also support the development of the tools that I mentioned earlier. So on this screen, you can kind of see, if you haven't already walked by one, what our sensor generally looks like in the field. At the top left corner is a photo of that sensor installed on a U-channel post. We've received permissions from DOT in order to put these sensors here. And attached at the top is a solar panel, making it such that the sensor can function without any connection source. All of the sensors are accompanied with a sign. This is an outdated version of what the sign looks like. Now this sign is much bigger and includes a QR code that will allow people walking by to scan and access the dashboard, which I'll come to talk about as well. Now, this project is one that includes a mandate from DEP to install 500 flood sensors across all 5 boroughs. Right now, we have 265 sensors deployed and are still working to figure out where the remaining seats are going to go. Again, this mandate specifies 500 sensors, and that's where we're working toward by mid-year of 2027. But all of the things that we're doing to build out this sensor, we ensure that the information for what this technology is and how is accessible to all. So there are groups that exist that are attempting to kind of make their own sensor using this information. Of those, 36 sensors are currently installed in the Bronx, and we're going to be using the remaining part of the project to focus on these areas that you see with a gap here. The laser pointer doesn't work on the screen, but in the space of Upper Manhattan and the Bronx, as well as in Staten Island. And so some part of what those installations will look like will be collaborative with DOT to deploy in what we call a little bit of complex spaces, including the expressway here. Now, this link at the bottom is where you can access the information from this dashboard directly. Each of the dots that you see here represents a sensor that is live on the street. The sensors, if you remember from the image that I showed, are only able to capture information in the exact spot that they're located. And so part of the plan for how we deploy sensors is to ensure that we can kind of get a better sense and a picture of what flooding looks like in a particular area. And so sensors are more oftentimes deployed in like the lowest elevation of a space. And we use suggestions that come from community residents, from agencies, and from analyses that our researchers are doing to determine where that location is and what's the best place for a sensor to live. As I mentioned, the sensors are collecting data every single minute and uploading it to a public dashboard, which is what you saw. And so when you click on the dot, which the number inside of that dot changes depending on the level of flooding that it collects using sound technology. It uses an ultrasonic sound. It is not a camera. I forgot to mention that earlier. You're able to see the navy blue line represents the kind of data that the sensor collects. And then the teal line is information that you can overlay with that, which helps you compare what the sensor is collecting with what the tide levels are, or even precipitation data. Now, this is an example of the usefulness of this. So on the storm that happened on the 29th of September in 2023, which was right after Ophelia, our sensors, which was a sparser network, you can see, we were able to capture 26 locations where flooding was occurring, with the max depth being at 36 inches in Brooklyn and Gowanus. And so this picture is from that area, which many of us saw pictures of like this circulating at the time. And you can kind of see in the dots there that the color is changing, and the number is also giving you a reading for what is being noticed at the bottom. Data from that day at that sensor looked a little bit like this. So you can see that the information being collected here on this y-axis, the line going up and down, you can read the depth, and at the bottom you can read the duration of what that flood looked like. How long did it take? Which could give you information like what the drainage in a particular space looks like. And the teal bar there is what precipitation looked like that particular day. Now on the back end, and for city agencies in particular, we've been developing a different dashboard that allows you to put multiple sensors in conversation with one another. So this is what that looks like just for gazing purposes. You can kind of see that these are multiple sensors in Brooklyn, in that general area on this specific date. And And so accompanied with that, part of what we are hoping to learn with about half of the sensors deployed in the field is what else could this information do? How else could this information be used? Realistically, the information can exist, and that's great, but if people don't know how to read it or use it, then it doesn't really give us a sense of what the impact is going to be. And so that's part of what the work here is, learning how flood depths can be used and this information can be used. So this presentation will also be shared with all of you. If there are ideas and thoughts that you'd like to share with the team directly, I'd be happy to collect those. In addition to that, we're also using that data to develop other types of projects that either we think can be useful or that we've been asked by community residents and organizations that work really closely with us. Some of those, in addition to that dashboard, include a printed report that Sea Grant is developing. I'll show you what that looks like in a second. But they are basically taking the sensor data and putting it together with 311 calls in a particular neighborhood and making it comparable to photos that residents themselves have taken and submitted to Sea Grant through the Flood Watch Project or through MyCoast. Both of these are a tool. MyCoast is a statewide tool where you can submit photos of flooding and then it becomes a part of a larger archive of data. We also make our data available to anyone who asks. And so through our website, you can actually submit a form and download the raw version of that data for analysis, which is useful for researchers and other agencies and folks that are trying to manipulate that information. We are in the process of developing an alerting system using these sensors, so ensuring that the sensors can kind of send off a notification when flooding is occurring, and based off the level of that flooding that is being detected. That is in beta form right now. It's not yet publicly available, but we are testing it out with a few city agencies right now. And finally, NISM, the Office of Emergency Management, is also using our data to develop a separate tool, a separate visualization tool to be able to distribute FloodNet data in real time to other agencies, part of which because the sort of platforms that different agencies use can impact how they see data and how they access it. This is a little bit more on what that alerting system is meant to do. Again, it sends out alerts via email, which we are still working to develop that technology to ensure we're not sending alerts when it's not a flood. And we are developing that technology using a machine learning process so that it's kind of automating when a flood is happening and when is not happening. This is an example of what that printed report I mentioned earlier looks like. And I should say that this was something that was developed in line with community residents who were meeting in focus groups and asking for something that they could just print out and share with their neighbors, share in their community advocacy spaces as well. And so you can kind of see the first page is on the left. There's a map of where the sensors are located, the addresses of those sensors, as well as little dots for what it looks like when folks are making 311 calls. Now, 311 fatigue is something that is documented where, there are neighborhoods where people just stop calling or neighborhoods where people are calling a lot. And so that is something that we're taking into consideration and being able to put these different data streams together. And here at the bottom are photos, again, that residents themselves took and submitted through FloodWatch or MyCoast and the MyCoast tool. And part of the reasoning for that is what community members were saying is that they didn't even really know what constitutes a flood. If you're in a neighborhood and you're normally seeing still water, you may not even identify that could constitute a flood or an issue that could be exacerbated under heavy precipitation. So likewise, there's on the second page another comparison of what sensor data looks like in relation to a rain boot as another way. This is another example. Now, these tools are all being developed and used through the community engagement work that I lead. We have right now 57 organizational programmatic partners and looking to grow this list. But all that means is that we have folks who are committed to helping us better inform the development of this project and also share awareness and skills around how to read this this data and use these tools. And I'm moving a little bit past these just to kind of show that we also make an effort to ensure that we're co-editing and co-producing educational materials with those partners based off of what they think is needed. So this is an example of a one-pager that is simply meant to just delineate where a neighborhood is, what flooding looks like there, and what other flood-related projects have happened in addition to FloodNet sensors being available in that area or hoping to be available. Others of this looks like this one pager we worked on with Regional Ready Walkway, which was about making considerations for mental health and disaster planning. And part of the idea was that if you're asking folks to submit suggestions and ideas, they also need to want to mobilize, and mental health could be important there. Further in this sort of skill building and educational space are 3 modules that I've worked to develop with the team that support one end of the project, but also encourage folks to continue participating in these flood efforts. So one is on taking pictures and the importance of that using the Mycos tool. Another is on reading the dashboard. How do you interpret that data? And the final is on the technology because, again, it looks like a camera. And we want to make sure that it's clear that it's not. So throughout all of that, we've collected information over time about what are some of the key things that folks are interested in. And so this is another give back to the folks in the room. Again, not meant to go through all of these, but just in general, some of the things that we've encountered is that there is a demand for resources and there's a demand to understand what projects like FloodNet are meant to do in a community and why they exist. And so we're taking that into consideration and also opening up the conversation to folks who may have relevant feedback to share with us. There are some questions about what does it mean to have a sensor and be in spaces where maybe flood insurance is really important. Now, flood insurance spaces are not using our data for their work, but that may not be obvious in just seeing a piece of infrastructure in your neighborhood. And so those are other things that we talk through. And then the other part of it is interested in knowing how the things that we're building on the community outreach side and education side can permeate in other spaces through city agencies and what is or is not useful outside of just the community organizing, community-based space. And so we continue to ask those types of questions to our city partners as well in monthly meetings where we're providing these updates and sharing back what we hear. So with that, this is the last slide that includes a QR code that we've used to collect sensor locations specifically from folks. This form is the best way to let us know where you see flooding or where a sensor might be useful because it also geolocates the location that you've shared on a map that we can kind of feed into our analysis pretty easily. So I think with that, I'll take any questions about the project and also share... There is a slide here. Oh, there it goes. That includes our direct contacts if folks want to reach out to any of us. It includes our academic researchers, myself as the lead on community engagement, and two of our agency partners that work really closely with us at OTI and at MOCEJ. Thank you.
Thank you very much for that presentation. Again, we will share this presentation with all of you, especially for those communities that suffer flooding throughout the years and especially with the larger storms. But Peter from Community Board 10 is a city island.
Is the flood zone that is prone to have. So this is great to have this information and especially to give warnings to both agencies and others about the potential dangers of flooding. But going beyond that, is this going to be used to try to mitigate some of this flooding by improving the sewers in those areas?
I think the short, uncomplicated answer is yes, that's the goal. Working closely with DEP and other city agencies is affording them an opportunity to look at this information in real time and act on it. And so the idea is that once the sensor network is grown, and we have information, we can only have it when the sensor is there, that those kinds of efforts will be included.
I'm just curious, why are the sensors on the poles and not in the catch basins?
So these particular sensors are collecting street level flooding and are relying on the solar energy to be powered independently. So that's part of it. But the technology that we've used to develop the sensor can be appropriated in other ways. And so we do work closely with folks who are trying to develop the uses of a sensor in a catch basin or underground, in basement homes as well.
So why I ask is because the city's infrastructure is largely part of the reason why the city floods, and the catch basin network could use the data to be upgraded. So like certain ones don't function how they, or can't take on the capacity that they need, and this data would be perfect for it. But yeah, just saying.
Thank you for sharing that. I would also say, like, the other part of it is as we were developing the project, making sure that there was a piece of infrastructure that every neighborhood had, regardless of the context for why that particular space was flooding too. But there are neighborhoods that have tried to put our sensor, or suggested to have the sensor in a space where they know the catch basin is going to flood as well, as a way for them to kind of get attention from the city agencies who need to do that work and cleaning it.
Are there any other questions? Okay. If not, thank you very much. Would you just sign in when you came in? I don't know if you did. Thank you very much. That concludes the presentations for today. I just have a couple of announcements, but before I get to our announcements, are there any announcements from any Borough Board members? Okay. If not, just a couple of quick items from our office. The annual prom dress and suit giveaway is being held this Friday, April 11th from 5 to 8 here at Bronx Borough Hall. First come, first serve. We are still in need of young men's suits. So if you do have any suits or men's paraphernalia for a prom, we are still taking those items. On Wednesday the 16th, we're having a NYCHA Advisory Council brunch and workshop here at Borough Hall, where all of our NYCHA Advisory Council presidents will be here to talk about solutions to issues within NYCHA. The Bronx Health Link, in cooperation with Senator Gustavo Rivera, will be having a community baby shower at Monroe College, also on Wednesday, the 16th. On May the 3rd, which is a Saturday, there is a gospel concert in Co-op City at Dreiser Loop beginning at 12 noon. And then finally, Bronx Week will be here soon. It starts on Monday, May 5th, with the conclusion on Sunday, May 18th, with the parade, food festival, and concert on Marshall Loop Parkway. And
All right, thank you. Two more events I wanted to add. Thursday, April 24th will be the Bronx Denim Day March to raise awareness and support for sexual assault. That will be here at Borough Hall at 3 p.m. And April 30th, we are going to be hosting a Diabetes Action Summit in partnership with Health People, Bronx Care, and the New York City Department of Health. We will circulate the flyers and more information on that later today.
thank you. And as you heard from the Not 62, diabetes was one of the major issues that are affecting the borough. So we encourage you to share that information and to participate. If there is no other questions, no other comments, thank you all for being here. This meeting is adjourned. And please sign the attendance sheet outside if you did not.